about to perform my newborn assessment on my doggy named Bowie. Okay, so one of the first things I'm going to do whenever baby is born is I am going to check his vital signs. So I'm going to feel his chest for respirations. I'm going to check his respiration rate, and it should be between 30 and 60. And then I'm also going to listen to his heart rate, where the apical pulse is, and that should be between, or it should be above 100. I'm also going to check his temperature and assess for any pain, if he's in any kind of pain. Next, I'm going to weigh him. I'm going to weigh him in pounds for mom and dad, but for hospital, I'm going to weigh him in grams. And I'm also going to measure the length of how long my baby is. So I'd use a tape measure to measure the length of my baby. And while I have this out, I would also measure how the circumference of his head, kind of where the brow is, his chest, and his abdomen. Okay, and no, go back. Come here. So, next I would listen to his abdomen, because babies, whenever they're first born, they do have vowel sounds. So I would listen to his abdomen. Okay. I would listen to his heart and his lungs. There might be fluid in his lungs, but that's normal for a newborn. And then I'm going to roll him over and listen to his back lung sounds. Okay. Next, I'm going to assess his skin. So I'm looking at the color, texture, turgor. I'm also looking at lanigo, which is hair. It's normal for newborns to have a little bit of hair kind of around the back area, which this baby has a lot of hair. I'm also looking at vernix, rashes. Vernix is the milky kind of stuff that's all over the baby. And then I'm looking at rashes like the Mongolian spots and stuff like that. Next, I'm going to assess the reflexes of my baby. So I'm gonna assess the Moro reflex, which is like the scared reflex. So I'm gonna like snap, and then the baby kind of, and then I'm going to use my pen light to look at his eyes for his pupil constriction and all that, and to see if he's blinking or anything. I'm also doing the rooting reflex, which is where I touch one side of his head and he will turn to that side, and then I would touch the other side and he would turn to that side also. Next, I would put my finger in his mouth to make sure that his sucking reflex, that he would suck on my finger. And then while my finger's in his mouth, I will feel for the hard and soft palate on the roof of his mouth. Then I would assess the palmar reflex, which I would use my finger, and babies would grab my finger. So I would check both hands, and then I would I could do it along the feet, and his toes could kind of curl a little. Next, I would do the Bambinski, which is the upside down J on his foot. And whenever I do that, his foot would curl and his toes would curl a little also. I would do the tonic neck reflex, which is where I would turn the baby's head and his arms and legs should follow. Trunk incurvation, so I would put baby on his belly, and then I would run my fingers along the side of his torso, and he would kind of curl a little bit like that. And then I would check for prone crawl while he's on his belly. So whenever you place the baby on his belly, he would kind of scooch a little. And while he's on his belly, I would also assess his buttocks to make sure that everything is symmetrical, and I could also assess his anus. Okay? Okay. So next, I will be doing the head to toe assessment. So first I'm going to start with his head. I'm looking at the shape of his head, the general shape and the appearance of his head, and then I'm feeling for molding, and I'm also feeling for the anterior and posterior frontanelles, which should be flat, and then I'm feeling for any kind of edema, and I'm also looking for any blood blisters on his head, which are called staphylohematomas. Okay, and next, I would be assessing his face, so I'm looking at his symmetry and looking to see if there are any marks or damage to his face due to birth or anything like that. I'm also assessing to see if there's any amelia, which are just little bumps on the face. They look like little mini pimples, but those are normal for babies. Next, I'm going to assess his nose to make sure that he can breathe through his nostrils. Okay? Sometimes babies' noses are smushed, but that's normal for birth. And but we just want to make sure that he can breathe through his nose. And then next, I would assess his ears. So I want to make sure that his eyes are even with the top of his ears. I also want to make sure there aren't any tags on his ears or anything like that, because that would indicate that there might be abnormalities within the central organs. And then I would want to check the recoil of the ear. I can't really do it on him, but that's where you fold the ear and it would pop right back. And then we would also, while we're assessing him, we would just kind of assess his hearing. And so babies are able to recognize their mother's voice once they're born. So if mother's talking over here, baby would turn head. So that would indicate that his hearing is okay. And then, so after ears, I would assess the mouth. So I'm making sure that the mouth is symmetrical and that the tongue is freely movable. Next, I would assess the eyes. I would assess the, make sure that they're symmetrical, even on both sides, and make sure that he's able to blink, the coordination of his eyes, everything like that. The cornea reflex, the red reflex, we would also assess that on him. I would also want to pull down his eyelid to make sure that it's pink in there. And then I would assess the color of his eyes, which are dark. So next I would assess his neck. I want to look at the appearance and make sure that there are not any abnormal folds or anything like that. I would want to make sure that his neck is freely movable, so I would kind of move it a little bit. And then I would want to assess his clavicle. Next, I would assess his chest. And since I've already listened to his lung sounds, I don't have to do that. But I would want to note that he has unlabored breathing, which is good. And then I would want to assess the appearance of his breasts, which his are flat. I've already listened to his heart, Now I would assess his abdomen. I've already listened to his bowel sounds and I have measured the circumference of his abdomen. I want to assess the umbilicus and that there is a clamp there. And then I would want to assess his femoral pulses. Okay. Next, I am going to assess the extremities and the trunk of the baby. So I want to make sure that he's able to move and that everything is symmetrical. He has 5 fingers on both hands. He has 5 toes on both feet. Then I would pick up my baby and assess his spine, and normal curvature of the spine whenever we pick up a baby from the belly is rounded, so that's good. And then I would want to assess for hip dislocation. So I would grab his legs, pull up and out to make sure that his hips are not dislocated. Then I will assess his genitalia. If it were a female, I would assess the mons, clitoris, and vagina. He is a boy, so I am going to assess his penis and make sure that the urethra is on the top and not on the bottom. I would assess his scrotum and make sure that he has rogae, which are the wrinkles, and then I would want to assess his testes to make sure that it's descended, and whenever I assess, I should feel little almonds. Then I would assess his elimination pattern. So his urine should be clear and odorless. Bowel pattern, he should have a bowel movement right after he feeds. And we do want the baby to pee and poop before discharge. And then lastly, I would assess jaundice, which is the yellow skin tone. Pathologic jaundice is not good. That's when a baby is very yellow within the first 24 hours of being born. Physiologic jaundice is okay though. It's just when the baby is just a little bit yellow about day 2 after birth. So I believe that's it for my newborn assessment. So thank you.